This conference will now be recorded.
So, good afternoon, good morning, depending on where you are in the world. My name's Piers Clark and I'm the chairman of the ISLE Group. It is a delight to be with you again, talking through the updates that have been put onto the WhatsApp group, the COVID-19 WhatsApp group. We are recording this webinar and all the slides will be available afterwards. As you know, we hold this webinar once a week and we hold it twice. It's an identical webinar. We hold it once in the morning for the people in Middle East, Australia, and once in the afternoon for the people in North and Latin America. And the people in Europe can attend either one because it's how the days fit. Today's presentation is going to be in two parts. So there's a first bit, which will be 15 minutes, where I will cover quite quickly the key points that have been brought up during the WhatsApp chat. After that, there's then a second part, which you can stay for if you want, or feel free to drop off, where we're going to do a sort of frontline interview, a chat with someone in one of the Italian water utilities. Before we kick off, I think it's also worth noting that there's been a bit of a change in focus for these webinars. The WhatsApp group has evolved. In the first week, there was quite a lot of chat and sharing around health and well-being and how people can best work from home. What we've now seen is over the last week, there's been quite a lot of movement towards some more technical and water industry specific issues. And so we've actually structured this presentation around those. We've picked out 3 questions in particular on the operations side and 3 on the asset management side, and you'll see that as we come through. If you've got anything that you want to raise, can I suggest you raise it on the chat, and we'll be watching what goes on in the chat, and that's the best way of catching everybody's attention. So without further ado, let's commence. So here we go, the COVID-19 group on a page. This morning, this group had 129 organizations on it. It's still going up every day, so we're now at 135 utilities from all around the world. A lot in Europe. Europe's the main hub. There's 184 people on the WhatsApp group, which is why the chat becomes quite hard to follow. But that's also exactly why we're doing these webinars, to enable you to tap into quite quickly the key findings from it. It is also worth noting that this group has reached beyond the WhatsApp group, and I put there at the bottom, we've got the reference to WaterRA's news stream. We're also linking quite heavily with the WASA, the Water Services Association in Australia, and with Water UK in the UK. We're aware of all these other groups who are doing things around COVID-19, and we're trying to make sure that the information that's shared here on this group is shared as widely as possible, so that we can have maximum impact in terms of sharing the learnings. So if we come into the themes that have been shared, as I mentioned a minute ago, what I'm going to do is talk through the questions that have been raised by the group, and we split those into 2. Some around operations and some around asset management. I'll then touch on some of the pending questions, the things that people have raised but not yet been addressed. And then I'll summarize some of the resources, and we've got links to all of them. So if you find that there's a particular resource you want to tap into, we've got the links here for you. And then we'll finish with the interviews with the frontline utilities. So jumping into the first operational question, which came up, and this was around operator masks. It came from Tullio in Italy, and it was around the scarcity of operator masks. They were finding themselves in a situation where they just didn't have the PPE. And just to remind you, Italy was the beachhead for the virus when it hit Europe, and so they were basically 10 days, 2 weeks ahead of the rest of Europe in terms of having to address this issue. And where they have been looking at was reusing masks, washing them with a mixture of hypochlorite solution and alcohol, and then reusing them. What's interesting, and I think I saw that Jerry's on this call, Jerry shared that the Health Protection Surveillance Centre in Ireland had basically flagged that the PPE becomes less important than actually complying with the social distancing restrictions. And so actually, it's much more important. The learning that we've got here is that it's much more important to be rigorous on the behavioral aspects of where people are operating than necessarily sticking to trying to trust that just because you've rewashed a face mask, this is going to protect you. There's more information there, and there's some more resources at the bottom should you wish to refer to them. The second operational question that came up was how to manage operating staff shortages as the epidemic progressed. This question was first raised by Rolf in Cape Town, South Africa, and we had some similar questions coming from people in Europe. And the summary of the answer there is that in general, it looks like everybody is adopting a sort of quarantine shift work approach where people have split down their shifts and they've actually got them quarantined in a single location. So the second bullet point there, AADC, which stands for Al Ain Distribution Company, which is in the UAE, obviously. Al Ain normally have 3 operating shifts. They've split those down into 2 12-hour shifts. They've then got a third team, which is operating on different tasks as a sort of backup team. And then really interestingly, they've set themselves up with a 4th team, which will be ready to be mobilized should things go pear-shaped on them. And I guess what they're planning there is that should someone in one of those quarantine teams fall ill, it's actually going to take out the whole team. The other point I particularly liked here was Rand Water in South Africa. They not only are screening the staff and operating them shifts, but they're also actively reducing the footprint that the operational staff are active over, to reduce down exposure. The third operational question was around decontamination and what's the best way to decontaminate yourself or your clothes. This was flagged by a colleague in the Philippines from the Department of Health, and Kathleen actually shared the sort of recipe for what they do for the solution they're using for decontamination. That then led to a bit of a debate around is it necessary? And actually there's a bit of reassurance here that in the water sector, the CDC, Elsevier, and the US Occupational Safety and Health Administration are all taking the line that there's no evidence to suggest that just because you work in the water sector, you're any more exposed than you might be in a normal role, which I think we can take a certain degree of reassurance from. Again, on this second slide, here's some more resources around that topic. Moving on to the next 3 questions, we sort of put into an asset management bucket as opposed to an operational one. And this one came from the Middle East and was around the impact on water and energy use. And there was a similar question that came from Australia, in particular around what does it mean for our revenue model. And I've seen that in today's chat, these slides were obviously prepared 24 hours ago. In today's chat, there's been a bit more detail around the exposure on how different utilities are coping with the change in water usage, with now everybody working from home and the crashing of water use in most industrial sectors. The point here, you can read the words yourself, but the point that was being made here was in the Middle East, our sort of water industry colleagues there were sharing their issue around the stress on the system that they're seeing and how they've modeled certain scenarios to address that. They've been able to do it successfully in production for water production, but they haven't yet done it for network planning. And there's a sort of call here for it would be great to share more information on this. When we had this presentation this morning, this topic obviously struck a chord with a number of people who were on the webinar first thing this morning. I think that's why we've subsequently seen that there's been quite a lot of chatter today around this particular topic. The next question was around collaboration. We're all moving into a new world, and I think we're all going to have to get used to what the new post-COVID-19 world looks like. Fortunately, in the water sector, we are incredibly open at collaboration. We're not like the pharmaceutical sector or the white goods sector, where people keep trade secrets themselves. In the water sector, pretty much universally around the world, people who work there are open to collaboration, and that's demonstrated not least by the fantastic involvement we've got in this this chat here. There's been the sharing of some of the great platforms that are out there. I've already mentioned Water UK, and the UK is a forum for UK water companies to share on this call, because it's obviously of the time zone that catches North America. I'm aware that NAQA and AWWA and a whole bunch of the associations in North America are pulling together and sharing their learning. I think we're only going to see more of that, and more of it hopefully happening not just on a national basis, but on an international basis. And then the last question, which actually I thought was the most interesting of all of the ones that got raised this week, was around monitoring and measurement of the coronavirus. Now, if you were on last week's webinar, you'll recall that I mentioned that there'd been this initial evidence that the virus was killed in wastewater treatment, and then overnight, just before we did the webinars, there seemed to be this news that maybe in the Netherlands there'd been evidence that suggests that it was surviving wastewater treatment. Now, we've dug a bit more into that, and there's some data shared here. It has come from a not yet peer-reviewed report, so it has to have a sort of healthy caveat around it. But the interesting work that was done in the Netherlands was that they started taking samples from sewage treatment works before the outbreak came, and they were monitoring for certain RNA type samples in the wastewater. And what they found was that as the outbreak swept across the Netherlands, swept across Holland and the region, they were able to record that in their samples. Now, we don't believe that it's viable, so let's be absolutely clear that this is not a suggestion that wastewater treatment is not killing the virus. The relevance here is that it might provide a really useful mechanism for working out, is the virus present in this particular community, which then enables us to be much more intelligent in terms of what areas we might want to shut down, where we might want to do the sort of social lockdown of people, so that we can minimize the disruption. Now, that has then led on to an investigation into, there's a whole bunch of technology out there that is being developed, which will work up solutions for addressing these problems. And if anyone on this call knows ISLE, you'll know that we are essentially technology brokers. We bridge the gap between end users and technology inventors. And actually, what we've done in the last few days is we've made an outreach to see if we can pull together a sort of suite of technologies that might help the water industry better address the COVID-19 challenge. We're only early into this, but we've had something like 25 companies respond to date, and they fall into a series of buckets, actually. We've got them, some around contamination and detection, some around remote monitoring, some around deactivation of the virus, and some technologies around contingency planning. What we're proposing is that over the next 7 days, we'll work up that, and maybe on this webinar next week, we'll have a bit of a technology focus that will enable us to share some of the learning from that exercise. So those were the 6 questions. There was obviously other issues, but those were the 6 main ones that we thought that got pulled out of the WhatsApp chat. Hopefully you've seen that there's resources against each of those slide decks. On top of that, there's then these questions were the ones which we thought were particularly pressing. So the first one is whether there's any evidence for the use of technologies to help fight the pandemic, and I think I've just talked about that enough. The second question came from South Africa again, and was asking about how we can reduce the transmission at public water taps and shared toilets, in particular in urban and peri-urban communities. Now, we don't talk about it much, but when this virus hits the shanty towns of some of the developing countries, the countries that don't have the affluence or sort of government control that we're maybe more used to in most of the countries where people on this webinar are from, I think we're going to see a terrible impact on communities. So thinking ahead as to how some of those, how maybe that impact could be reduced would be incredibly useful to share that learning. And then the third question there was actually one of the first questions to be raised on the WhatsApp group, was around how do we protect operators if they have to go into public homes for emergency activities, and that one hasn't yet been addressed much. So we then come to resources. There's so much resource that's been shared on the WhatsApp group. It's impossible for anyone to do a day job and read it at the same time. So we've done that for you. So we've listed here your daily go-tos, and there's the COVID-19 water blog, the GWI hub, and then there's an interactive web-based dashboard that we think is particularly useful. We've listed the sort of research and R&D sites which we think are worth going to if that's your particular interest. And then on this page, you can see we've also identified the water and wastewater utility specific links. There are then some interesting reads, which if your appetite for learning about COVID-19 hasn't been sated by all the other links, feel free to dive into those ones as well. And then finally, if that wasn't enough, there are a number of documents which we haven't been able to provide links to, but we do have copies that we can email you. So if any of these documents on this sheet look like something that you'd like to read, let us know. Either email myself or Charlotte DeWitt, or indeed anyone in ISLE, and we'll get these documents over to you. So with that in mind, I'm going to bring this first part of the presentation, the webinar, to an end. Like I say, the aim was to give you an overview of what's happened on this week. The next webinars will be a week today. We are thinking, because the group's getting quite big, and because it's we're getting quite big and cumbersome, we're thinking of maybe trying to split it out into an operational group and an asset management focused group. And if you've got a particular preference or or a view about that, please let us know, and we'll maybe get there, because I suspect over the next week we're going to reach the limit, which is 256 people on the WhatsApp group. Now I'll just pause for a second before we go into part two, just to check that there's nothing that needs to be raised. I've just realized my screen was hiding all the comments, so I now see that there's quite a lot of comments there which I've not. In fact, one of them says you've disappeared. Can I just check that you can still hear me?
Yes.
Yes.
We can hear you.
Hear you.
Slightly wired there. One of the comments says
you're perfect.
Oh, good. Right. In that case, let me. We will review those comments and pick up on them. If anyone's got anything particular they want to raise, now is a good time to do it. Okay. So moving on to the second part of this, which is talking to interviews with sort of frontline utilities. Now, we deliberately reached out to 2 utilities in Italy, because as I mentioned before, Italy was the beachhead for the virus in Europe. This morning, in a minute, I'm going to come to Angelo Siragusa from AMAP, who's our sort of go-to man for this afternoon's webinar. This morning, I was talking with Montagnoli Tullio from A2A, and he was basically sharing how their operational methods have changed and what they are expecting to keep in a post-COVID world, assuming we ever return to some sort of normality. Now, this morning's webinar has, just like this one, been recorded, and should you want to listen to that, then we've got access there. Before I introduce Angelo, or as I introduce Angelo, I'd also like to say that Angelo's English is much better than my Italian, but Angelo's English is not perfect. And to help us with that, I've got a couple of my Italian colleagues on the line as well, who, if we need to do any translation, we can tap into their skills as well. So Angelo, if you're there, I'd like you to take yourself off mute while I introduce you. So Angelo works for AMAP, which is one of the water and wastewater utilities in Italy. He's been there for 38 years, and he is the manager of the wastewater treatment plants and the labs. AMAP is a public company, and it serves 35 utilities. And I think, Angelo, if I remember correctly, your background training, you were a chemist by first degree and then moved into chemical engineering. Is that correct? Angelo, are you there?
I don't see his name in the list of attendees.
Okay. All right. Well, we'll just give it another second. I do know what he was going to talk about, so I will share briefly that. It would be a shame to miss him. I don't want to steal his thunder by saying what he was going to talk about and then him arrive, because that would be terribly rude.
Yes. Let me give him a phone call to see if he's available or not.
Thank you, Andrea. Thank you for that. All right, while we just wait for that little connection, can I now pick up on a couple of the comments that have come here from people? So I'm going to go to Jerry, because Jerry Galvin, you've been brilliant and very vocal on these on the WhatsApp chat. I see here you're talking about the prevalence of COVID-19. Could you just share a bit more around that?
Okay, no, just in relation to the testing of wastewater for COVID, I'm not sure how reliable such tests will be, because everything I've seen from both our health services executive here in Ireland and from the European Centre of Disease Control and from the WHO is that a diarrhea is a very rare symptom of COVID-19.
Okay, all right. Thank you for that. Yeah, well, I think you're absolutely right. I do put a heavy caveat around the information that came from the Netherlands trial, in that it isn't peer reviewed. It does need to be explored, but it's useful for us to know about. I can also see George Ponton, if you're there. George, can you give us a sort of Scottish Water take on things?
Yeah, can do. We're also gathering samples at the moment to do some kind of RNA and assays with the Roslin Institute, so that's due to start. I think we've already started the samples, and they're going into cold storage until such times as the Roslin Institute get their labs up and running to be able to do it. So that's due to start fairly soon. And effectively, we are running the whole business in instant command mode, just to make sure we're focusing in on the core service. So that's the main priority, to deliver the core water and wastewater service as safely as we possibly can.
Understand what standard PPE is.
Yeah, so that's one that's kind of exercising us, I would say, internally. The guidelines are kind of saying that normal PPE is suitable for working with wastewater, even with COVID being there. I'm just interested to know what kind of standard PPE is for people, because I suspect there's probably varying standards across utilities and across countries. Because the World Health Organization guidance doesn't go to specifics; it's quite generic.
Right. Well, we'll try and gather that. Charlotte, can we maybe put a post out on WhatsApp after this to capture that, and just see if we can get a bit of a list of what standard? Because, like you say, I think we'll find there's some differences. Okay, in the interest of time, let's just see. Angelo, are you? It feels like a seance, this, doesn't it? Angelo, are you there? Angelo, Angelo, are you with us?
Yes, Marco Fatozzi speaking. I just talked to Angelo. He had problems in connecting, but he's trying to correct me now. So we should be able to talk in a couple of minutes.
That's okay. Maybe we can roll him next week's forum. On that matter, while we wait for Angelo to join us, if anyone's got something they particularly think would be useful to share, or anecdotes which are worth putting on, then please do let us know, and we will add these in. This morning we had 77 people on the WhatsApp on the webinar, and 71 of them stayed all the way to the very end. And I can see that we're still at 73 now, even though various people have been dropping in and out. Now, I've also just seen that, Angelo, you've managed to connect.
Yes, I am. Do you listen to me?
Yes, we can hear you. Thank you very much for joining. I'm sorry that it proved to be a bit of a challenge for you. Are you able to speak now?
Yes, do you listen to me, Pierre?
Yes, we can hear you. So I've already done an introduction to you. So you were going to share around your experiences on smart working and some of the advantages, rather conversely, some of the advantages you've seen around the COVID-19 experience. Can I hand over to you to speak? And if there's any problems, Marco is on the line as well, and he can translate.
Okay, Pierre. We have worked very well in smart working, and also we have increased our productivity, because some work also in future, I think, is possible to work from home with the saving of cost and more efficient for work. Also, for this, we think in future to do permanently in our organization. For other advantage for the activity we bring now, we have good result in the lake search for lakes facility, because with the silence we have solved many problems that in normal condition we don't solve, and COVID have helped this situation. We have solved some drinking pollution, water drinking. Also, COVID has been a proud of the 9 for the water safety plan, because in past month we study about the water safety plan, and with this emergency we have do a real simulation, and we have many to do for a new problem. Okay.
No, I love that. I love that. It's bizarre but very reassuring that our water safety plans. This is the moment when the water safety plans really come into their own, and it's confirmation that we as an industry have, in general, got a lot of things right. We may not got everything right, but in general, we've got a lot of things right. I'm going to pause just for a minute because I'm aware of time. We've been going for almost half an hour, and it's obviously people have got busy lives. If anyone's got any specific questions, either for Angelo or anything they would like to share, now is a good time to raise your hand or take yourself off mute.
Please, can you repeat slow, please?
It's actually it's okay, Angelo. I was talking to the wider group there.
Do you see me?
Mark. So I'm going to draw the call to a close there. Thank you very much.
There is a question here in the chat.
Oh yes. Now I see you.
Okay, so there's a question here, Angelo. There's a question here for you from Alexander Mokas, which reads: during the COVID-19 outbreak, what percentage of staff did not report to work? And was this because of sickness, quarantine, fear of infection, school cancellations? What was when at the height of the outbreak, which I guess is what you're experiencing now, when was it good? When did how many of your staff did you lose?
Yes, during smart working,
Marco, I might need you to.
about, yes, we have about we are 19, I think about more than 15% is in smart working. We are less than 1,000.
Okay, thank you for that. 15%, I think, is the answer of where you got to. Excellent. All right, thank you very much. Angelo, thank you for sharing that experience.
Okay.
I'm sorry.
Sorry for my,
No, that's
sorry
okay.
for my colleague.
It's absolutely fine. It's good to have you with us. Everyone, thank you for your time. Keep safe over the next week, and look forward to reconnecting with you next week. Thank you.
Thank you.
Thank you. Bye-bye.
Thanks. Bye.
Bye-bye.
Thank you. Bye.
Bye.
Thank you. Bye.
Okay, Pierre. Salutation. Bye bye.